a little bit late. There's a few IT arrangements to register and welcome and admit at up to 800 participants. We've had a fantastic response rate to this afternoon's session. My name is Kate Alexander and I'm the Senior Practitioner for the Department of Communities and Justice, and I'm coming to you from Ashfield at the Office of the Senior Practitioner. And it's my great pleasure to be your MC for this afternoon. I start by opening this meeting by acknowledging and paying my very genuine respects to Aboriginal people across whose lands we all meet this afternoon. In Ashfield, I'm sitting in Wongal and Gadigal land, and I really want to honour the people of the Eora Nation and the traditional custodians of the land that we're all working from. I acknowledge this land was not taken peacefully by my white ancestors, it was taken with great force. And Aboriginal people fought for their land then with courage and resistance in battles of unwinnable odds. And they've fought for their children every single day since. Our practice in DCJ is truly changing for the better at the same time as we really opened our ears and our hearts to the experiences of Aboriginal people, have partnered with our Aboriginal colleagues in much more useful ways and listened to the experiences of children and their families. So now I'd like to welcome you all to this really important webinar on building lifelong connections for children and young people in out-of-home care. My understanding is we have up to 800 participants from our own department, Department of Communities and Justice, and our very valued partners across the sector. We've got two fantastic panellists who I'll be introducing shortly, two fantastic speakers, sorry, and then a panel that we will have afterwards. So that's the way this will work. We'll hear two presentations. We'll have a chat for some questions to the two presenters, and then we will go to a bigger panel. We all know that the experiences and quality of out-of-home care can be critical in determining whether children can recover from the effects of trauma and separation and are more able to access opportunities in life. We know that a very big part of this feeling for children is a sense of belonging. I think one of the saddest things we've all learned about the experiences of some children in care is an experience of loneliness, and how important it is that we all work together to talk about loneliness for children and work with urgency to connect children to meaningful relationships with their families, their communities and their cultures. In the past, people have thought about or measured permanency in terms of placement stability. Placement stability in plain English really means do children have safe and stable homes, loving relationships that will see them through to adulthood. But through research and our interactions with children and young people, we now know so much more about permanency. We know through the work of CREATE, who you'll hear from later, and our DCJ partnership with the wonderful UC Change Group, which is the Young People's Advisory Group, who certainly keep us on our toes and have brought such useful insights to our work. What they tell us is that permanency is not an event, it is a process. It's different for every child and young person, and for many permanency is felt. It is a feeling rather than a state. We also know that creating and maintaining enduring connections for children out of home care does not always happen. We know that organising and spending time with family members or other people important to a child can be hard. It can be an anxious and unsettling time for everyone involved, children, young people, carers and birth families. While challenging, it is so very important for both now and for a child or young person's future that we help children feel connected to people that matter and can help them all be all they want to be. So today we will be hearing about two very different research projects that have examined a number of aspects that both help and hinder children and young people's contact and connection to the people who are important to them. We'll hear from both speakers and then we will invite questions from you. So now it's my great honour to introduce our first speaker, Judy Cashmore. Judy is a Professor of Social Legal Research and Policy at Sydney Law School and Professional Research Fellow in the Research Centre for Children and Families, Faculty of Arts and Social Sciences at the University of Sydney. Judy has a PhD in Developmental Psychology. A considerable amount of Professor Cashmore's research has been on children's experiences of and involvement in legal proceedings and other processes where decisions are made about children's lives and the implications for law, social policy and practice. Today, Judy will present on findings from the DCJ-supported Pathways of Care longitudinal study, which looked at children's relationship while in care, what is important to them, what choices they have, as well as the experiences of both families and carers, and importantly, what the findings mean for policy and practice. I'm really excited to have Judy here. Judy's always been incredibly generous with her time and her insights, and made herself available to support the work of our profession in so many different ways for the better of children. So welcome, Judy, and thank you.
Thanks very much, Kate, and thank you for the invitation to speak today. And I'd also like to pay my respects to elders past, present and emerging across the nation. Warramai. So I'm going to be talking about research, the analysis of the Pathways of Care longitudinal study. And that's a study that's taken quite some time to get going, and now it's taken, we're now 10 years down the track, and the exciting part of collecting the data. And so there are a number of people who are involved in that study, and I'd like to acknowledge all of their involvement. The aspects that I'll be talking about today are really about children's relationships. And so when we talk about family time and so on, that's a means to an end. So what we're looking for is children to have relationships with their family and with their carers and with other people who are important in their lives. So there are a number of questions that we asked of the data. So we looked at 3 waves of data, and that report is about to be published, I understand. So to what extent do children maintain contact and relationships with their birth family and their kinship network? How does that relate to their socio-emotional well-being? And how are some of the problems managed, and particularly managing transitions? But what it all boils down to is the importance of belonging. That what all children need, and particularly children in the care system, someone who cares and somebody who is there for them, and that includes their siblings. So Marina Paxman and I, some time ago, did a study, the Leaving Care study. At that time, it was called the Wards Leaving Care study because they were actually wards at the time. But we followed a cohort of young people who left care aged 16 to 18 over 4 to 5 years, just before they left care, just after, 12 months later, and then 4 to 5 years later. And the best predictors of how well those young people were doing 4 to 5 years later was the number of supportive people they had around them. And the really key aspect was having had someone somewhere they could call home, and someone who loved them. The ones who couldn't answer yes to that last question about having a home and someone who loved them were the ones we interviewed in detention centres, in refuges, and in very transient accommodation. So that has really underpinned a lot of my interest and so on, and in terms of how important these relationships are. And so we're talking about the role of the time with family and other people who are significant, the role of the people they're living with, and it's not a zero-sum game, it's summative, it's a cumulative effect, and it's the number of people around them that they can call on. So the sort of model that we used was to do the analysis was this one here, which is looking at the key aspects. So children's relationships with their carers, with their birth family, their siblings and those they lived with particularly, and also the carers' attitudes to those relationships and time with their birth family. And that in turn influenced the frequency and timing of face-to-face time and other ways that children could be in contact. a lot of what some of what we found was exactly what we would expect and are consistent with previous research. So we know the differences that came out in terms of children in relative and kinship care were more likely than those in foster care to have more frequent face-to-face time, at least monthly, with parents, siblings, grandparents, aunts and uncles and cousins they weren't living with. They were also had contact with more family members across all 3 waves. They were more likely to be living with siblings, and they were more likely to have a good relationship with family members as reported by their carers. And the children, they were also more likely to have frequent face-to-face time if they weren't living with their siblings, but they were also more likely to be living with them. What else did we expect and know? Well, what we've seen across a number of studies is that fathers are less likely to have contact with their children in care. But when it does happen, it was regarded quite positively by the carers. And to some extent, that's likely to be a selection effect. And again, that comes down to who were the children living with. Were they living with paternal relatives? We knew that they were in kinship, relative kinship care, but we didn't necessarily know from this whether they were paternal. Surprisingly, they were also more likely to have unsupervised contact than mothers were, and much more so when their children were in relative and kinship care, and their carers were more positive. So I think this is one of the avenues for exploration around the invisibility that's been reported about fathers in child welfare work, the complexity of these families and how many fathers might be involved in some cases, which makes contact with siblings and across families more complex. But again, there is also some likely selection factor here, because there may be a safety issue. Just to quickly show you, that shows you that fathers in both relative and foster care are less likely to have contact, as you know, those 2 graphs and the relative placement. But when they do, they're just as likely to have at least monthly face-to-face time as mothers are. Now, this is based on children in the same households across all 3 waves, but later I will be talking a little about changing households. We can talk about that in comments. Of course, face-to-face time is not the only way, but it is the primary, and supervised contact is the main way in which children do have time with contact with their parents and siblings and other members of their family. But there are other means. But I guess what's a little surprising about some of these figures is that they're lower than I would have expected them to be. But again, the same pattern, that you've got greater propensity for children to have phone contact when they're in relative kinship care than foster care, and more likely to have overnight stays. Of course, we've now been through a period of COVID-related constraints. We don't know yet what the impact of that will be, but some of what Amy and Billy will be talking about is some ways to manage these other ways, and using that as a means to actually facilitate the face-to-face and manage contact and relationships when face-to-face time can't work or isn't right for the children at that time. So looking at the main findings and the time with siblings and other family members, you can see from this that if we look at relative kinship care, that about 2/3 of children in wave 1 in relative kinship care were co-resident with at least some of their siblings. And that remained reasonably stable over time. It was lower for foster care, and again it remained reasonably stable, but it was lower. So what were the carers' most common concerns about contact? This was consistent across all three waves. The first one, the parents cancel or they don't show up, and that's problematic because it really is distressing for children to expect something, to be prepared for it, and then for it not to happen, and feeling in some cases, and often maybe, that they're being rejected, not understanding why it isn't happening. That the parent's behaviour can be problematic, and that means that they may come substance abuse, substance affected, or they may say things that can upset children. That was more a problem for those in relative kin care, but the perceived adverse impact on the child was less for those in relative kin care than for foster care. The hostility between, or perceived hostility between the birth parents and the carer was again greater in relative kinship care, but it reduced over time. And that was a predictor of the child's socio-emotional well-being and also the frequency of contact. Just to have a couple more things here about 80 to 90% of carers indicated that contact was meeting the needs of the child in their care very well or fairly well, which is a good, positive indicator, with the exception of foster carers of Aboriginal children. There weren't as many differences between Aboriginal children and non-Aboriginal children as I might have expected, but I think some of that's taken up by the relative kinship care aspect of it. Interestingly, the relative kin carers were also likely to indicate, as well as foster carers, that children needed more frequent or consistent time with family members rather than less. And that those who reported that it was meeting the child's needs were more likely to have more frequent time. We need to think more about some of the possible feedback loops in that. But just to move on now, so why is it important? Why would we be worrying so much about family time? Well, first of all, because it matters to kids. It also matters to their socio-emotional development and whether or not they're in a good place to learn and to develop to their potential. So we know that children who had time with both or at least one parent had better socio-emotional well-being, lower CBCL problem scores than those who had contact with neither parent. Not surprising. We know that those who were living with siblings in the care household had significantly lower problem scores than those who weren't, whether or not they had contact with siblings outside. And we know that children in relative kinship care had significantly lower CBCL scores and problem scores than children in foster care. And that those whose carers said that contact was meeting their needs and not having an adverse impact on them had significantly lower CBCL scores. So just two other things here that affected children's or predicted children's problem scores. The more, from children's ratings, the more emotionally responsive they said their carers were, the lower their internalising scores, their anxiety, as reported by the carers, which is really important. We also know that children who indicated they were very happy living in their current home had lower externalising CBCL scores. And the other really significant predictor was, what did carers say about their own self-reported warmth and hostility of their own parenting style? They were very significant predictors of how well the children were doing. Again, really significant. So just coming back to the model that we started with, it shows that all of those relationships come into play. So how well children are doing is a function of how good their relationships are with their carers, how comfortable they are, children's relationships with their birth family, whether they're able to live safely with siblings, how much face-to-face time they have with their family, and what are the carers' attitudes to that time and that contact. Just lastly, so appropriate safe contact is a time for children with family members is really quite emotionally challenging for everybody, for the children, for the birth families, parents and the carers, and it doesn't just happen. We really need to work at it and work at ways to support that. So there are a number of aspects that you need to take into account here. Mitigating the difficulties of frayed relationships, where it's going to happen, not in an office preferably, but somewhere that everyone feels comfortable, and co-placing children with siblings as long as that's safe. And the ultimate is the payoff in terms of the children's security or the security of the placement and how well children are doing. And that's what we're all looking for. Thank you.